The purpose of this film is to describe the theoretical and practical aspects of the Gram stain, developed by Dr. Hans Gram. The Gram stain is a differential stain which separates bacteria into two categories, namely gram-negative and gram-positive. These differences can be explained in part by the thickness of the bacterial cell wall or the peptidoglycan. Such that gram-positive bacterial cells with a comparatively thicker cell wall will appear purple. Gram-negative bacterial cells will appear pink upon completion of the Gram stain. The Gram stain is used primarily in the clinical microbiology laboratory. The following stains and reagents are components of the Gram stain. A primary stain, crystal violet, is used to initially stain the bacterial cells in the previously made smear preparation, a purple color. A second reagent called Gram's iodine, which serves as a mordant, a chemical which increases the cell's affinity for the crystal violet stain, forming a crystal violet iodine complex. A decolorizing agent, 95% ethyl alcohol, is used to remove the crystal violet Gram's iodine complex from the cell wall, assuming that the cell is gram-negative.
A counterstain, safranin, is subsequently added to the bacterial cell's slide preparation to stain the bacterial cell wall pink, again if the cell is gram-negative. The stained bacterial slide preparation is then observed under the light microscope under oil immersion. Gram-negative cells appear pink, gram-positive cells appear purple. Not only does the Gram stain differentiate gram-negative from gram-positive bacterial cells, but it permits the reader to simultaneously identify bacterial morphology. Gram-positive Bacillus coccus or spirilla, gram-negative Bacillus coccus or spirilla. The Gram stain is from a single bacterial colony or may be performed directly using a clinical specimen. Example, blood, cerebral spinal fluid. The technical aspect of the Gram stain is performed as follows.
The first operation to do before you do the Gram stain is to heat fix bacteria. First step in heat fixing is placing a small drop of water on the center of the slide. The next step is flaming your loop until it's red hot. The next step is opening the test tube. Flaming the lip of the test tube. Okay. And taking some bacteria from the slant in the test tube. Okay. Flaming the test tube. Putting the lid back on the test tube. And then placing the bacteria in the drop of water by a circular fashion to make a milky preparation. The milky preparation is apparent to the individual doing the heat fixation procedure. The transfer loop is then flamed. And then with a forceps, the slide with the bacteria is passed 2 or 3 times over the flame. Then one waits until evaporation starts. Again, 2 or 3 times. Okay. Then one waits until evaporation continues. The slide cools, then you flame 2 or 3 times again. Again, 2 or 3 times in the flame. Okay, wait until the slide cools. You don't want to incinerate the bacteria. You want to heat fix the bacteria. Heat fixing the bacteria refers to the drying of the bacteria, which then causes the bacteria to stick onto the slide. Again, 2 or 3 times. Okay. Then you wait for the slide to cool. And at this time, the bacteria will be fixing onto the slide. Complete fixation is achieved when the bacteria is totally dried following passing of the slide through the flame. And the individual doing the work has to make sure that it's an opaque, whitish color and no water is left on the slide. The first step in the gram stain procedure is to cover the smear with crystal violet stain for 1 minute. And one would use either a staining tray or horizontal tracks over the sink in the initial crystal violet staining. One should be sure that enough crystal violet stain covers the smear. There is a 1 minute incubation of the crystal violet stain. The next step is to grasp the slide with a slide holder and gently rinse the slide with distilled water. The purpose of the rinsing is to remove excess crystal violet stain from the slide, with only the crystal violet penetrating the bacterial cell remaining. The next step is to cover the smear with iodine stain for 1 minute. Flood the stain with iodine. The slide is flooded with iodine, and what we are achieving at this time is forming a iodine crystal violet preparation. And the iodine serves as a mordant to fix the crystal violet in the bacterial cell. This reaction will lead to either the crystal violet staying within the bacterial cell or the crystal violet leaving the bacterial cell. The slide is rinsed to remove excess iodine, and an iodine crystal violet preparation is now on the slide. The next step is obtaining the 95% ethyl alcohol. Just a few drops are placed over the slide until a runoff is clear. That is, until you can see some blue material washing from the slide, and the drops are placed over the smear. The next step is to grasp the slide with a slide holder and gently rinse the slide with distilled water. The next step is to add the counterstain safranin, which is an orange color, for a period of 1 minute. If the bacterial cell is a gram-positive cell, the crystal violet will remain in the cell. The orange safranin will not stain the cell orange, and the cell will be deemed a gram-positive cell. If the cell is a gram-negative cell, the crystal violet should theoretically have been removed by addition of the 95% ethanol, permitting the orange safranin counterstain to then stain the bacterial cell, producing a pink color. A pink color designates a gram-negative bacterial cell. The safranin remains on the slide for a period of 1 minute. The safranin and the slide is then subjected to a wash with distilled water. Make sure all of the safranin is removed. The next step is to take the slide and place it in bulbous paper. This procedure is to dry the slide for observation under the microscope. Once the slide is dry, the slide can be observed under the microscope for the presence of gram-negative or gram-positive bacteria.